Hi, everyone, and welcome to the Tulsa World Opinion podcast this week. And we are I'm with Laura Bellis. She is a Tulsa City Councilor for District 4, but today I'm talking to her in her role as the Executive Director for the Take Control Initiative, because we have some very exciting news for women's reproductive health this week from the FDA. And you were inspired to write an op-ed for the Tulsa World this week. Everyone's going to read it and they're going to love it or not love it. Either way, it's a discussion and we'll have a talk. Mm-hmm. But before we begin, thank you for joining me this week. Can you explain a little bit about what Take Control Initiative is and what the nonprofit does?
Yeah, so Take Control Initiative is the nation's longest running contraceptive access program. We've been around since 2010, making sure that all Tulsans have access to birth control. And we do that through education outreach and then free clinical services for people that are uninsured or underinsured for all methods of birth control.
So how many people do you serve a year, would you say?
So through birth control services, that number's grown a lot. We serve about, hold on, let me think of all my stats. We directly through IUDs and arm implants, we serve about 2,200 people a year. Through other methods of birth control, we're providing about 6,000 to 8,000 prescriptions a year. And through Plan B, recently, we've been providing about 6,000 prescriptions a year, and through then education and outreach and all those other services, that's about another 10,000 people.
Wow. So and just to remind me, when were you launched? When did
we were launched in 2010? So we're 13 years old.
Oh, that is a big reach in 13 years. So let's get to the op-ed in the news of the day, which is the FDA approved the Opill, which is a birth control that is expected to be on the shelves next year. So can you explain a little bit about what the FDA has approved and what is the Opill? What type of contraception is it? Just give us the basics.
Yeah, so the FDA has approved Opill, which is a daily oral birth control pill for use over the counter, right, without a prescription. And Opill is progestin-only. That means it does not have estrogen in it. And so it's a really safe method of birth control for people to access without a prescription. Some of the reasons that other ones are more available by prescription is they either have to be given by a provider, like an arm implant or an IUD needs to be inserted, or for some methods of birth control pills, there may be contraindications, which means if you have another medical condition, it's good to know before it's prescribed. With Opill, it's really broadly safe. It's been around for over 50 years. And when it's progestin only, it doesn't have estrogen, that means there's less likely to be contraindications, and it's really safe for people to access over the counter without needing a prescription.
It is a little bit of a mind switch, because so many of us women are used to having to go to the doctor to get a prescription. And I would imagine that there's still maybe a little fear that maybe we should still go to the doctor to figure out what's right for us. Mm-hmm. I mean, do you think that how popular do you think this is going to be? How will this change the landscape for women?
Yeah, so people definitely should still go to, for instance, their annual Well Women's exam. And it's really helpful to talk with a doctor and nurse practitioner about the full array of birth control methods, because this may not be the right option for everyone. And right now, of all of the people who access birth control pills, it is used about 4 to 6% of the time. So this is definitely not a one-size-fits-all solution. And there are other options that, if someone's really concerned with preventing pregnancy, are more highly effective. For instance, with the Opill, which is with typical use about 93% effective, about 2 people out of 100 during a year of use will get pregnant using this method with typical use. So if someone's main concern is preventing a pregnancy, they may want a different, more effective option like an IUD or arm implant that are 99% effective, right? However, for people who want a pill, they don't want maybe estrogen as a hormone, but like progestin works for them, this can be a really good option if they prefer to have a method they can start or stop without a clinician's assistance. And so what this really offers, especially for communities that don't have OBGYN providers nearby, or you have folks that are uninsured, have transportation barriers, all of these challenges to accessing a clinic. Maybe they even just have work hours that aren't conducive to getting to a doctor as often as they would like to, which is another challenge we can address. This is a really good option for folks to be able to just go walk into a retail setting like a Walgreens or a Walmart or a CVS and just be able to pick something up. This can also be really helpful for people if maybe they're in a domestic violence situation and they can't use or don't feel safe using their own insurance or a partner's insurance. Now here's something that they can access without someone knowing that they've gone to a doctor, used or put something on their insurance without appointment, and having to face that kind of circumstance. So this does open up another avenue of option for people who may have different barriers. And it's going to be very helpful in rural communities. There's a significant OBGYN shortage in our state. There's a primary care shortage in many of our counties. Actually, I think only 5 are not considered areas with a primary care shortage. And so for people in rural communities where clinics may be far away, there's not an OBGYN, this is a huge step forward for access if they're far away from that kind of care.
Is there any idea of how much this is going to cost? Like, what is the retail going to be on this?
So the company that makes Opill has said they're going to seek to make it as affordable as possible, but they haven't put forward a price point yet. The Biden administration has also said that they are going to strive through policy work to ensure that insurers are covering over-the-counter birth control as well as prescription birth control, but we just don't know what the price point will be yet. That is something I'm a bit concerned about when it comes to access. When Plan B, right, the morning after pill or emergency contraception was first approved, and it went into to be over the counter, the retail price of it was $50, and it still is $50 in many settings. There's some places, including online, where you can get it for maybe $9 to $12, but you'll see in a lot of pharmacies today, it's $50 for one pill, which is very unaffordable. At Take Control Initiative, we bulk purchase it for about $5 to $6 per unit. And so what we're talking about is a big retailer markup with that method. And so I am worried with Opill, we could see the same thing. I appreciate that the company is committing to seeking to make it affordable, but what's affordable to some may not be affordable to everyone.
Well, I wanted to take a minute to talk about birth control in general. I think that's sort of the next frontier in defending women's reproductive rights, because I've always believed that there's this constant chipping away, and I do strongly believe that we should never feel comfortable that our rights are secure. So I do see this as sort of the next issue that as women we need to be paying attention to. But I see so many people not understand what birth control is. When people come to you and they're talking about contraception, do you find yourself having to dispel the same myth over and over again, or concerns that people still have about birth control?
Yes, I think it's interesting. With the majority of methods, people do understand that it is preventative of a pregnancy, that it can help healthy birth space between pregnancies to ensure people have healthy birth outcomes. And we find a fairly firm understanding. People may not fully understand how each method works. Of course, the biology can be a bit complex. That said, people don't have huge reservations. Where we see and hear frequent misconceptions, especially today, is around emergency contraception, right? Plan B or the morning after pill. And people will confuse that for being an abortifacient, which it is not. It does not harm an active pregnancy. And so that's one of the biggest misconceptions we deal with. And so I always want to make it very clear to people that if something is a contraceptive, it's birth control, it is not an abortifacient. It does not cause an abortion. And that's always really important to make clear, regardless of what people think or believe about abortion. It's important to make sure people know that birth control is not the same as an abortion.
Okay. So, and that's one thing I was going to ask about, because I'm hearing that more and more, that people are equating it, and I wanted to and
some of that gets into where medical accuracy meets the law. There's a lot of, and this has come up in laws that have been passed over the last few years, and then ones that date back to the 18 and early 1900s. The terms that are used to describe pregnancy and contraception and abortion, some of them just aren't very clear medical terms, and that can cause a lot of confusion. Like when we talk about pregnancy or fertilization or implantation of an egg on uterine lining, these are all slightly different medical concepts, but in the law and the way they're written, there's a lot of confusion in the language. And I think that then confuses people when we talk about what birth control does, about if it's interfering with a pregnancy or not.
One of the things I found interesting, I've written about, was when you look at the data in Oklahoma. Well, they don't collect the data anymore, but we had, as you well know, detailed data on the women who got abortions, everything from the reason to the number. I mean, it was, and when you look at that, and then you look at when Take Control Initiative started, which also started about the time evidence-based sex education programs went into Union and Tulsa public schools and here and there, but schools are still real resistant to sex ed programs. Abortions went down sharply. I mean, it was not a coincidence. It was a correlation, because it was just the same time. But now that, Roe has changed things, what have you seen in the last year as far as services? Are you seeing more people come for services in the last year? I mean, what effect did that have on the contraceptive service providers?
Yeah, we have seen, oh man, there's so many impacts, which I'll mention per your point about the data, right? From our baseline year of 2009 through 2017, which is the last time that we had abortion number related data, we saw over a 50% decrease in abortions in Tulsa County. While abortion was still legal and we were providing contraceptive services. And then during the same time frame, you see over a 50% reduction in the teen birth rate. And so, right, it isn't rocket science that when you provide people with resources and information on preventing pregnancy or waiting until someone's healthy and ready for a pregnancy, that then they access those resources if they want them, and they work. And so we do know that those are the things that drive down abortion rates. What's hard now is it's immensely difficult to know what the data might look like today, especially given the patchwork of landscape of access across the country, though we do have proximal states where abortion access is still legal. What this has looked like for us working in contraception, right, which is that's Take Control Initiative, we have always just focused on birth control access, is we've definitely seen an uptick in people reaching out to us, wanting to access services, accessing birth control. So in the year 2021, this is where we've seen the biggest spike. We had provided, through clinics we partner with, about 91 Plan B morning after pills. And last year in 2022, we provided about 6,000. And some of those were proactive provision where people were like, let me have this on hand just in case. But I think it showed that anxiety people have about wanting to make sure that they have every resource where if they're not ready to be pregnant or don't want to be pregnant, that they could get it as soon as they could. And we got a lot more kind of panicked calls with people seeking emergency contraception or an emergency IUD placement, wanting to make sure they could be as safe as possible and healthy as possible in preventing a pregnancy. And that's been a big impact. We're just hearing from people a lot more because they just have a higher level of anxiety there. And then for providers, I think what's been challenging, there's a few things, is one, the laws can be confusing, especially when it comes to miscarriage management and life-threatening situations that a woman may be facing during her pregnancy and what they are able to do or not legally. And that causes, right, providers are concerned that they can't do what's best for their patients in those circumstances. And then that has made it harder to recruit. We're hearing that OBGYN residency programs here have had major recruitment challenges. I've heard that from doctors, which, given that we already have a huge shortage of OBGYNs, is very concerning. Largely, OBGYNs are broadly supportive and continuing to provide birth control services, and we're glad that that's still very clear for people. But as less people feel able to practice medicine to their best of their ability, it just makes it's an unfriendly environment for them to practice medicine in. And we are seeing physicians leave. There's kind of active studies and surveys going on right now. We don't know what those numbers are, but it's very concerning.
So where are women getting birth control? In Tulsa County, women can go to your organization or the clinics that you partner with. But outside Tulsa County, where do people go?
Yeah, so outside of Tulsa counties, the best options people have, in Oklahoma County, you have Variety Care, which is a really big federally qualified community health center that has 17 sites. But outside of our big urban hubs, it is really challenging to access care. You have the State Department of Health sites. So that is a big access point for people, but that's, they can only do so much with what they have. They provide excellent services, but are under-resourced. And there's definitely some challenges and fluctuations that have happened with federal funding for family planning services recently. And so access in rural communities is very difficult. People may be hours away from care for birth control, for maternity care. And so what that leaves people with access to then is, either they're going to have to go a long distance or what's available to them through online or telehealth if they have internet access and so much more, which that gets into broadband challenges. So for folks in those communities, they may be very far from care. If they have transportation challenges, there's really not a lot of options for people. And so that's why with this FDA approval, it's really big for rural communities because there are not a lot of other options. A lot of birthing hospitals have closed over the last 30 years. There's not many other clinics available. The OBGYN shortage most impacts those rural communities. They're really just short on options, and a lot of rural communities cannot access the full range of contraceptive methods, if any, with ease.
Do you suspect this doesn't seem to have the controversy, I will say that I thought it would. And because I was thinking there would be pharmacists say, I'm not going to stock it, or stores say I'm not going to have it on the shelves, but I'm not hearing that at this point. What's the likelihood you think that will happen?
I mean, it's possible, as just rhetoric and kind of propaganda or misinformation can be disseminated very rapidly through social media. So I could see that becoming a trend if people aren't really diligent at getting everyone accurate information. That said, birth control is such a popular resource that I may be foolishly optimistic that it'll continue to be that way. You do have, again, around emergency contraception, because of misinformation, at times more controversy, but with just medically accurate information and conversation, those myths can be dispelled. And so I'm optimistic that when Opill hits the shelves, it's birth control. It's been around and prescribed for over 50 years. The same pharmacists who've been disseminating it through prescriptions that they're given might then be, in the same way emergency contraception is provided, be able to be asked for it if it's, maybe sitting behind the counter for any reason. And so I'm optimistic that just hopefully roll out without significant controversy. But I do know that there are forces that would seek to take away some of these resources from people. And I don't want to underestimate what propaganda online can do.
Right. It is hard to argue against something that's been available for half a century. But I know that there's still people who are worried about side effects or misuse. What are some of the side effects? I mean, and what is the likelihood of it being misused and causing harm in some way?
Yeah. So a lot of these things are actually safer than Tylenol. There's misusing Opill. The biggest thing or concern with a method like this, if you're trying to prevent pregnancy, is if you don't take it at the same time every day with regularity, then it's just going to be much less effective at preventing pregnancy. That's what misuse looks like, or that someone doesn't go pick up the next pack that they need on time to keep taking it consistently. Otherwise, this isn't something that has a significant health risk for misuse. And it has, for people, an array of possible side effects. It just really depends on the person. Everyone kind of reacts to medication a bit differently, but it's pretty typical what you might typically see with different birth control methods about how it could, cause lighter menstruation. Some people may experience, kind of from hormones, just those kind of emotional shifts. Some people don't, right? Some people that helps, some people it makes it different. It can have effects on acne. It can have effects for some people on bloating or not. There's some of those different side effects that are, a chance with a lot of hormonal birth control methods. But that said, for some people, they may not experience any of those, and many don't. So it's just nothing atypical is part of this method. And so for people, that's still why it's a really good idea. You may access this if you need something while seeking to get into a doctor to find a method that's best for you. This one can be what's called a bridge method. It can be very popular for that, where you might take it short term while you figure, right? It'll be available in that pharmacy setting over the counter. So someone may just go pick it up and use it short term while they seek to get into a doctor to find a longer term method that is better for them if this isn't their optimal best one.
And that was always sort of the issue, is that having to take it consistently was for some women who are disorganized or forgetful, that may be the best for them. So that's where maybe an IUD or, an arm plant, and that's the difference. But some women may feel more in control, that they want that, they're better at routine and like that. So
yeah, it's a lot of these can come into those lifestyle differences. What's kind of exciting is the ring, which is historically, it's a kind of like a 1 month at a time thing. There is now a ring called Anovera that lasts a whole year.
Wow.
So
I'm fascinated by the medical advances in general. And so I find a lot of these birth control arguments are dated, that they're old notions. People still are worried about blood clots from birth control, but a lot of that data is from like the 1960s, 70s. But it's hard. That's why I asked about the myths, because those are hard to break even after generations. And so, and that's why I'm excited about this, because I think it'll really help a lot of women. At the same time, I'm a little concerned about the access, the affordability part of it. So, especially in the rural areas. Do you find that the clinics, are there very many people from rural areas that come to the Tulsa clinics that you partner with? Are you hearing that people outside Tulsa County are making that drive?
Yeah, our urban centers do end up being a medical hub for the rural communities that surround them. And so there are a good number, I wish I had the stats, but I don't, but there are a good number of people that are coming in from other communities into Tulsa to get care. Sometimes, right, people are going, especially if they're seeking hospital care, multiple hours to get there, which is where you end up, especially if someone's pregnant and has, health issues, that can be a big access challenge. But a lot of people are coming into Tulsa County for an array of family planning services, birth control, STI testing and treatment, because we are a big medical hub, given that there are not many other clinics and providers across the state.
Mm-hmm. Well, I appreciate you talking about this. I think this is, great news for women, great news for reproductive health. But I want it for the guests, I always give you the last word. What are some of the parting thoughts you want to leave, maybe? And I want to promote again that you wrote an excellent op-ed summing all this up that people should read. What are the things you want people to leave with?
Yeah, I think one of the biggest things is it's exciting that this is going to be available over the counter. If you're someone who you're having trouble getting a doctor's appointment and need contraception as soon as possible, once this is available, this is going to be a great resource. And people should still absolutely go have that doctor's appointment, which Take Control Initiative, we can help people find a clinic or a practitioner that's right for them, to make sure that they're getting checked, they get a full well woman's exam, that they know all their options and can access them. And then another thing is, this is making one method more available, but as I mentioned, there's all these other methods, and some of them may be better for some people than others. And so one thing that's really important, and this almost happened last legislative session, is that we can get a bill passed this next legislative session to give pharmacists the ability to prescribe medications like contraception. And that could make a huge difference for rural access. It almost made it through the legislature. This isn't a controversial bill, especially when we talk about that need for more rural healthcare access, and that there may be more pharmacies than there are clinics in a rural setting or in proximity to a rural setting. The thing it got held up with is, there's that big back and forth between the governor and legislators that took up a lot of time during the session this year. And so it just got lost in the shuffle. But there was strong bipartisan support for a bill to give pharmacists prescribing power. And I'm really optimistic we can have that happen next legislative session. And that can make a big difference for healthcare overall in our state.
I didn't know that was up. I'd like to have you come back and talk about that, because so often I find the pharmacists, they're seeing what people are, especially if you're coming from different doctors, someone has several doctors, they're seeing everything that everyone has, and they often can know and make recommendations on what maybe a patient needs that a doctor isn't seeing. So that is a great idea. I'd like to hear more about that next. We'll have you on that again and we can talk about that. So
Absolutely.
thank you so much. I appreciate it. And everyone read the op-ed, and we'll celebrate, this win for women's reproductive health this week.
Thank you so much.